Emotion is the strength and weakness of human. Depends upon how we are going to deal with it. Sometimes we are trapped with our own negative emotions, which become more powerful and dangerous for our health. We start feeling lonely, afraid, and bitter. That simply hurt and leads to various psychiatric disorders like depression. When someone suffers from the depression, they go through the terrible emotional pain, and it is really challenging for how to deal with these emotional issues or how to approach these emotions in a more healthier and effective way. Today, I'm introducing mindfulness, which is most popular and universally practiced approach to deal with the difficult emotions. My name is Ashwani Pundir, and currently I'm working in the SGT University. Since last 5 years, I'm using mindfulness in the regulations of people's emotions. What I personally experienced, it is really effective for the people who suffer from frequent mood swings, severe anger and adjustment related issues, and for those who are suffering from psychiatric illnesses like major depressive disorder, bipolar affective disorder, recurrent depression, obsessive compulsive disorder, and clinical health anxiety. The beauty of mindfulness is it is easy, friendly, and fun-loving therapy. So what is mindfulness? The origin of mindfulness is from the Buddha philosophy, which emphasizes upon that life is not beyond the moment, that is right here, right now. Mindfulness is a way of enhancing awareness. Then how to enhance this awareness? That is through meditation, which actually means is to pay attention on purpose in the present moment and non-judgmentally. It means mindfulness is an awareness that comes through when we start paying attention on purpose in the present moment with the attitude of non-judgmental. In this video, we will know about one of the most effective technique of mindfulness-based cognitive therapy, that is 3-minute breathing space. And we will cover in 2 major parts. The first part is the education part that will answer of 4 basic questions: why we should do it, how it works, how to do it, and when to do 3-minute breathing space. The second part is the demonstration part that will help us to experience the effect of 3-minute breathing space. Why we should practice this meditation? 3-minute breathing space is the core technique of MBCT. It is formal meditation and also known as mini meditation because it takes only 3 to 4 minutes to practice. The fact says that in depression and anxiety disorder, people lost the awareness of the present moment. They lost into their thoughts and they failed to differentiate their thoughts and reality, as well as their cognitive mechanism is run by automatic gear, and they trapped into the loop and difficult to come out from it. Do we know that our mind wanders 47% of time? It means approximately 50% of time we are not living the life the way we want to live the life. Our mind is bombarded by 17 million bits of information. And you will be surprised to know that our mind can handle only 60 bits of information at a time. It means 99.994% time we are not fully connected with our surrounding. So understanding the facts, 3-minute breathing space may be a wonderful option to connect with the present moment. What is the mechanism of change? Does this meditation work on scientific ground? The answer is yes, it works. Neuroscientists proved the moment you practice this meditation, your brain starts altering. Let's see that Dr. Brower tried to understand how mindfulness altering the functions of brain. He uses a cap line of 120 electrodes on the client head. The electrodes were able to pick up signal from the posterior cingulate, which is the part of the brain linked to memory and emotions. Initially, the client was asked to think about something anxiety-provoking situation. When he thought about something stressful, the cells of posterior cingulate immediately start firing, showed by the chart of red line of computer screen. As he started mindful breathing meditation, within seconds, brain cells start firing quieted down, showed by the blue line of the computer. This way, the experiment proved that how a simple 3-minute breathing space may help to start altering the functions of brain. Behavioral scientists and mindfulness practitioners also believed the moment we practice this meditation, we start creating a space within our mind that helps us to control our actions and reactions which make the situation worst. How to practice 3-minute breathing space? 3-minute breathing space is a formal meditation in your everyday life. Breathing space gives you a chance to take a few moments to pause and step back from whatever we are doing. Becoming mindful whatever you are doing and becoming mindful of your experience in the present moment. And then carrying this mindfulness with you in the next part of the day. There are 3 steps in breathing space. Step 1 involves becoming aware. Becoming aware of what your experience is right now in the present moment. What thoughts are going through your mind? What feelings or emotions you are having? What body sensation is present? And then step 2, you gather yourself by bringing your awareness to your breath, following the physical sensation of your breathing in your abdomen and using your breath as an anchor that helps keep you around in the present. And then step 3, you expand your field of awareness to include a sense of the body as a whole. Noticing any physical sensation in your body and paying attention in your body sensation along with the awareness of your breath. And then bringing this expanded awareness with you into the next part of the day. How to schedule this meditation? You may schedule this meditation 2 or 3 times a day regularly. First, we may practice when we wake up in the morning before we leave for work. And after that, we may practice when we take the break from the work. And at the end of the day, at home to get relaxed throughout the evening. So this way, educational part is over. Now, you may have an idea about 3-minute breathing space and importance of it. Now you know it takes only 3 to 4 minutes to practice. So why not to experience 3-minute breathing space right now? So let's begin 3-minute breathing space now. This is a time to experience 3-minute breathing space. As you know, experience is one of the most important aspects if we want to sharpen our therapeutic skill. So I request you to keep aside all your belongings like your purse, mobile phone, watch or keys, etc., and choose a place to sit which is quiet and comfortable for you. Now, we may maintain any particular posture which suits us. It may be either sitting on the chair or sitting on the cushion or mat. Being aware of the way we are sitting right now. If we are sitting on the chair, make sure that our feet are well placed on the floor and our hands are properly placed on our thighs or supported by the hands. Our back is erect and well dignified but not tensed. Let's simply sit and doing nothing for some moment. And we may gently close our eyes if we are comfortable. And bringing our awareness on the immediate experience of our mind, that is thought, feelings and sensation. What thoughts are going through the mind right here, right now? Acknowledging this thought as best we can, probably like a mental event. What feelings are here? Acknowledging and unfolding the most uncomfortable feeling in this moment. What sensations are here right now? We may acknowledge the sensation in the body. It will be good if we can name those sensations like pain, pressure, heaviness or lightness. Now, if we are ready, then gently shifting the sense of awareness on our breath. And being aware of how our breath is going on. Now, if we are ready, then gently shifting the sense of awareness on the breath. And being aware of how our breath is going on. Noticing the abdominal sensation of our breath. In each inhaling and exhaling, how our abdominal wall is expanding and contracting. And this way, we may stay connected on our breath for another 1 minute. And then gently expanding the sense of awareness from breath to the whole body together. Noticing how we are sitting right now. How our facial expressions are. How our body is breathing itself. Acknowledging if any sense of discomfort, resistance and avoidance we are carrying for right now, right here. And then gently opening our eyes if it is closed. And expanding the sense of awareness from the body to the outside. This way, 3-minute breathing space ends here.
So this way, 3-minute breathing space is not only effective to deal with our emotions. In fact, it is also effective how to deal with our own mind. Thank you very much for watching this video so patiently.